Thank you for being an exceptional public servant. So, when I was thinking about what would I say this morning, I was thinking, why do we commemorate this day, right? The why. We commemorate this day because hundreds of thousands of people were affected by a disease. And as they were affected by a disease, and I keep thinking of all of the diseases that we've all encountered, there are very few diseases where you're shunned, where you're disparaged, where you are considered an outcast. And I can only think of two, all right, in time. One was in olden times, and I can only think of the early stages of cancer when people didn't know what it was. You would say the C word. I remember with my grandmother, anybody mentioned the word cancer, and it was like it would, it was just terror was set into everybody's heart. But even with cancer, you weren't shunned, you weren't disparaged, you weren't maligned. Some people even thought that it was the wrath of God, And so when you think about that, you realize that is something never to forget. And why do I say it's something never to forget? Because history has an ugly way of repeating itself, the good things and the bad things. And I am extremely proud and honored that we have activists here. Because if it weren't for those activists, even more people would have died. And I can tell, absolutely. They did not only raise their voices, they acted out. Because nothing less than acting out was what was required to really shock society into saying, stop. This is a disease, these are human beings, and we need to care for each other. And I'm eternally grateful for those activists and the money they raised and the research, because I'm Puerto Rican. And the next community that was affected by AIDS was Latina women, Puerto Rican women in particular. And I know that if that work had not gone on earlier, even it would have been devastating even to my community. So that is why we do it. That is why we honor, we celebrate, we commemorate. But most important, we don't forget. And we don't forget because we see something else happening today. We see a trans community being maligned, killed, abused, spat upon. And again, as a Puerto Rican, I know that they kill transgender community in Puerto Rico. It became like roadkill a few years ago. It's devastating. And that cannot continue. So it is important that we listen to a panel like this, remember what occurred before, remember what we must do to continue to do so that it never happens again. And that we say, call it out, rise up, act out. And with that, I'm going to turn it over to our panel. Good morning.
Okay. Good morning. I'm Andy Hum, your moderator. Since this is the Department of Aging, I'm 72.
Yay.
Hey, welcome all. Now, let me just ask, first of all, how many of you in the room have been affected by the HIV crisis, affected by it? People in your lives, people in your communities, know people. Yes, get a sense. And again, I don't want everybody to disclose, if you're certainly not, haven't done it before, unless you really want to. But how many people in this room are living with HIV? Okay, all right, all right. So, by the way, if you work for the federal government, the White House has forbidden you from speaking here. I mean that seriously, but I will not stop you from speaking. we're all going to introduce ourselves for 1 minute to give you a sense of where we're coming from, okay? I'm a gay and AIDS activist since the mid-1970s, or gay since the activist since the mid-1970s, an educator and a journalist, and I've covered this crisis since it was first discovered in 1981. I don't know if we did such a great job back then. We thought the government was going to take care of it. They didn't. I was a spokesperson for the New York Coalition for Lesbian and Gay Rights that passed the New York City Gay Rights Bill in 1986 with a huge coalition. I was the director of education at the Hetrick Martin Institute for LGBTQ youth, where we trained thousands of youth and youth-serving professionals on gay and AIDS issues. We got gay AIDS education in the schools back in 1991. And I've co-hosted the weekly Gay USA television show, a national show with Ann Northrup since 1995, where we always cover HIV and AIDS issues every week since 1985. We're going to go down the line, and our panel is going to introduce themselves.
Good morning. My name is Ivy Kwan Arce. I'm Chinese American. I've been positive since 1990. Activism that I have benefited. For example, the reason I tested was I saw a wheat paste by ACT UP about testing women, and back then the government messaging for health information did not include women, but the activists did that work. Sort of like what we're talking about, like maybe the government has decided not to show up for World AIDS. It doesn't matter who's in the White House or who isn't. We still do our work. So I've been also part of the PW Health Group, which was people with AIDS, and we used to actually import drugs before we had the treatments that we have today to help us survive, and that was all done by ourselves. And now I'm also a board member at the Treatment Action Group called TAG, and that organization has activists that I've known before the organization started, and a person that I would like to is important. His name is Richard. The UK and all his friends here in New York were dying, and here's an artist that self-taught the science, and today every research on HIV, including the ones that we had Richard monitor, challenge, and made better clinical trials, as he also taught the community to be activists and be inclusive in the work. So I'm also a mother of two sons, and I was able to have two sons because of the activism that we've done, and to bring new medicine where there was the stop transmission from mother to child. And the work that we did here in New York was groundwork for global care for stopping transmission from mother to child. So activism does work. It's a lot of work, but we're living proof of that. We're good.
And Laura's my boss. Hi, I'm Laura Morrison. Professionally, I work for the NYU Silver School of Social Work and Communications, and before that, I was the Chief of Staff to State Senator Tom Duane and his successor for the first term, Brad Hoylman Siegel. But I think I'm on this panel today because I was a founding member of the Treatment Action Group, which Ivy didn't tell you she's the president of the board of, and I served on the board for over 30 years, stepping down earlier this year, although I'm still a dedicated member and supporter. I actually got my start as an HIV/AIDS activist in New York City when I came back from college to start graduate school in 1988, and I met Tom Duane, who was then running for the city council. I was very much involved in the Columbia Lesbian and Gay Association at the time, and my friends, the men around me, were dying, and Tom came and spoke on campus, and I got involved with him. He took me to my first ACT UP meeting, and I became a dedicated ACT UP member. I was not an ACT UP leader. I was an ACT UP member, like so many others, who showed up every week, who went to the zaps or the actions we used to do. I was phoning elected officials. I was clogging the phone lines of the insurance companies, the politicians. I was part of an affinity group, putting myself in the line to get arrested, but I wasn't a leader. I was part of a movement, and that's what this is about. The reason we are fighting against this, we have made progress against this virus, is because we had a community of activists, and we have so much work still to do, and I'm honored to be on this panel.
Thank you. I'm honored to be with you. My name is Jacqueline
Keep
Dudley.
the mic up to your mouth, yep.
My name is Jacqueline Dudley. I'm Deputy Commissioner of the HASA program. The HASA program is HIV/AIDS Services Administration. We're a part of the Department of Social Services. And I've been with the HASA program for 15 years. And I am proud to say that the HASA program is one of the first and the largest governmental responses to the HIV crisis in this country. And we currently serve over 30,000 New Yorkers living with HIV and their families for a total of over 40,000 people. And we assist them with one-stop shopping access to all HRA-administered benefits. But most importantly, I think, is probably housing and access to resources, shelter allowances, supportive housing, because as we all know, housing is health care. And we are proud that HASA has been around for like 35 years, almost since the inception of the crisis here in New York. And the reality of living with HIV has changed substantially in that period. We're proud of that. We have moved from primarily a crisis management agency to an agency now who provides people with access to the tools that they need to live longer and healthier lives. And we're really proud of that. But we don't want to take our feet off the pedal. We realize that many advances have been made in the battle against HIV and AIDS, but we want to keep going in the right direction. We don't want to go backwards. And we want to keep going and make sure that the resources and the attention is there so that our community can continue to get what they need to stay healthy and maintain healthy, active lives. I do want to take 1 second, a couple of seconds to acknowledge a few people who are here with me before I forget, and that we have a couple of other assistant deputy commissioners from the agency, Sabrina Simmons, who was instrumental in putting this together. She's in back in the red holding the camera. And also Assistant Deputy Commissioner Susie Kadishon from HASA. And we have a few of our center directors here, Ms. Natasha Oliver and Ms. Burnett, who is also here. And a very, very important person to me is here, is that it's my friend, my mentor, and my boss, Mr. John Rojas, who's the Chief Special Services Officer here at HRA. And not only does he have HASA in his portfolio, but he has Medicaid, he has so many other things in his portfolio. We keep him very busy. And when I started at HASA 15 years ago, he's one of the first, and he was still at DOHMH at that time. He was one of the first phone calls, first emails I got to welcome me and to welcome me to the struggle and prepare me for what was ahead of me. So I'm happy that he's here. And also Mr. Ryan Murray from the Department of Aging, who's a friend and also a mentor that I've known for many years. Thank you.
Good morning. My name is Reginald Thomas Brown. My pronouns are they and there. I am a former HASA member. I am board chair of Vocal New York. I'm on the HIV Planning Council and the HASA Advisory Board. I'm also a member of the HIV is Not a Crime, the very first conference we had in 2014, a conference by people. All of us were HIV positive. And I celebrated 39 years HIV positive this past August. And I'm here because of the activists who said enough is enough. I'm here because of them. I'm in the fight now so that those come after me can get what I get now.
My name is Bill Gross. I use he, him pronouns. I am the Chief Services Officer at SAGE. SAGE is the world's largest and oldest organization dedicated to improving the lives of LGBTQ+ older adults. I've been with SAGE for 11 years now. I got my start in HIV in 1992, though, as an HIV pre- and post-test counselor at the Mazzoni Clinic in Philadelphia. and later as a member of the GMHC hotline, the GMHC David Geffen Counseling Center. I co-ran GMHC's Buddy program. Later, I headed up HIV counseling at Callan Lord Community Health Center. I've worn many hats at SAGE, but back in 2016, I, along with Tom Weber, who's back there, were responsible for creating our SAGE Positive program at SAGE, which serves LGBTQ plus folks over age 50 who are living with or potentially impacted by HIV. So that brought all of SAGE's HIV for the first time under one metaphorical roof. And it provides workshops and support groups and social events and case management, testing events, friendly visiting, referrals to legal services, mental health counseling, housing services. So I'm excited to be here today and to talk more about that.
All right, so World AIDS Day. Since the beginning of this pandemic, 43 million people have died of AIDS. Let that sink in. And there are 35 million people more around the world living with HIV now. This is still a massive worldwide pandemic plague. In New York City alone, 116,000 people have died of AIDS. They're going to be reading all their names at the AIDS Memorial in the Village this afternoon. Now, back in the 80s and 90s, when there was no effective treatment, a lot of young people were dying. You had maybe 2 years to live on average when you got it. That changed with some of the treatments. But I want to know from Ivy and Reginald, how did you survive?
Hello? Okay. Hello? Okay. In 1986, a doctor told me I had 2 years to live. I was actually dancing in Greece. I was a performer. The doctor said I had 2 years to live. I was not in New York during the time of The Walking Dead. I lived outside of the country from the entire decade of the 80s, so I was not aware of the horror that was going on here. But when I got that diagnosis, my universe stopped. It literally stopped. But my spirituality came in and kicked in and said, you know what? There are actually 3 blessings in this. The first blessing is that I didn't have to worry about getting it anymore. The second blessing was the importance of prioritization. This is important and this is not. And the most important was that no matter if I have 2 days or 2 years, I'm going to live until I die. So I decided that I kept on dancing. I kept on dancing. Hey, you know what? I'm still here. So you know what? Whatever you said, there's someone who said that no, I still have work to do. So my spirituality is what held me and what held me close. And I'm blessed that I had that foundation, because that is what has kept me. No matter what happens, I know that okay. There's someone else who's running this show. I'm only the dancer. I'm not the choreographer.
How do I survive? Because of people like you, because of people here in the panel. A bunch of people stepped up. I mean, everybody that either had HIV or their caregivers stepped up. We got ourselves into clinical trials. When we didn't understand, we learned how to do it. We learned how to include ourselves. We have people that completely put their lives as their sole work to problem solve this. We had doctors that had just graduated from medical school, and suddenly there was this epidemic, and a lot of gay doctors became HIV doctors. It didn't exist. They made this happen. They made this subject their priority. They taught us how to be informed patients. That wasn't a thing for most people. We used to be a society where we just have something, go to the doctor, and they will tell us what to do. We had doctors that completely pushed the line, found new ways of treating us when there was nothing. They created clinical trials, forced clinical trials to advance science. We had researchers that came in and wanted to help us solve this. So all this are many New Yorkers actually. I would say New York is a huge epicenter. And the reason I've survived, I think, is because I stayed in New York. If I had gone anywhere else, I don't think I'd be alive. Everybody that had HIV that were dying are the reason I'm alive, because they gave their lives and their data to make treatment happen and better. What is it? Like, so all my friends and all the activists, all the people that took care of it, I mean, nurses from St. Vincent that started God's Love in their apartment, those are the people that helped me survive. For everybody that did a clinical trial to look back and make sure that I had a space, it created space for me to be in those clinical trials, were the people that saved me. And myself is the reason that I survived it, because I put myself on the line. I made sure that I could create space and be in this work while I had other, regular work to do. I also showed up for people who were dying because their families wouldn't show up because of homophobia. So I think it's a whole community that was very courageous in the time that government did not show up for us. And also trying to survive a lot of the trauma within community. There was a time that even at Pride, people with HIV and AIDS were asked not to show up, especially people that had lesion, and we forget that. So it's important to know that survival includes understanding the communal betrayal and how much we have to navigate all that.
Okay. Now, thank you. We all lost friends back in the 80s and 90s, and they never made it to, some of them didn't make it to 30, most of them didn't make it to 40. The percentage of people in New York State now living with HIV who are over 50 is 57% now. Well, it's changed the dynamics of everything. Let me just ask Bill Gross down the end. You work with LGBTQ people at SAGE who are over 50. What percentage of your clientele is HIV positive, that to your knowledge?
I can speak up. Oh, okay. That is purposefully not a question that we ask on some of our intake materials at SAGE, but we estimate that between 15 and 18% of SAGE's population are living with HIV right now.
And so for those clients, who are living now much longer, what does that look like for them these days? What are their issues?
Well, I think it's interesting, as my two panelists were speaking before, I was thinking about certainly how much, to your point, Andy, how much has changed, but also how much the things that have stayed the same. So I just want to say briefly, thinking on today specifically, when we're talking about in the 1980s, a federal government's lack of response for HIV, in comparison to our federal government's lack of response today on World AIDS Day. We can certainly draw parallels there. I will also say that many of our participants at SAGE feel unsafe traveling, for instance, on public transportation, especially some of our older trans members who have experienced violence, both in name calling and actual physical violence. And many things have changed. And I will say that for many of our participants who are aging with HIV, there is now the possibility to look at not just surviving, but thriving with HIV and what that looks like in all areas of one's life. So on one hand, the necessity of making sure people have secure housing and food and that they feel safe, right? But then also having the opportunity as an agency and as the Sage Positive program to make sure that people are being supported in all aspects of their life, such as sexual wellness. And by sexual wellness, I'm not just talking about, oh, is this person taking precautions? That's part of it, right? But it's also, what does pleasure look like as we age? What does intimacy look like as we age? It might mean things about finding community, about making connections with other long-term survivors, perhaps, with ways of increasing and enhancing our physical health. And also just opportunities for leadership. I think we're trying to turn this kind of ageist idea of growing older on its head, where at one point it was all, oh, these people need services. We need to provide them. Whereas actually we find at Sage that many of our participants are actually leaders in their community, still leaders in their community, and giving them those opportunities to lead and to thrive in that area as well.
Thank you. So, Commissioner Dudley, how has the aging of the HIV population changed the kinds of services for people with HIV in New York? What's different now? And is this older population being reached by HASA? Maybe we'd better say what HASA stands for.
Hi.
But,
Good morning. HASA stands for HIV/AIDS Services.
Mike to the, yeah.
Why do I keep forgetting that? Okay. HASA stands for, is that too loud?
Yeah,
now?
no,
That's good? Okay, okay.
that's
Ha-
good.
HASA stands for HIV/AIDS Services Administration, which is a program within the New York City Department of Social Services. All of our participants are persons living with HIV or AIDS. You no longer need to be clinically symptomatic of HIV in order to be eligible. Anybody diagnosed with HIV is now eligible.
Hello. And that's because of activists like me who got arrested so that this could happen.
That's true. That is very true. It's very true. This man speaks the truth. And what I will say is that, as we've been talking about, I hinted earlier, the good news is that our clients are living longer. Our average HASA client is age 50, and or older. And we have many clients who have been with us for 10 years, 15 years, sometimes longer. So, and their needs have changed over the years. When they first came to HASA, perhaps their priority was getting cash assistance, just getting on Medicaid, making sure that they had access to health insurance, making sure that they had SNAP so that they were not food insecure. That might have been just the basic needs. But now, as they are thankfully getting older, we have to meet them where they are and see what their changing needs are. We have to work with them to make sure that they remain in compliance with, certainly with their health care, but it may not, only be the HIV now. It may be, cholesterol, blood pressure, things that we all deal with as we get older. Some of our clients may have issues with ambulation, and the good news is that HASA conducts home visits for all of our clients who are not able to ambulate and get around. They may need home care or homemaking services, and we're able to assist them if they need that, to get assessed and to get access for home care. We're able to escort them, if necessary, to certain appointments that they have, maybe with the Social Security Administration. So as our clients are getting older, we're able to meet them where they are and provide them with a myriad of services that an older population, not that 50 is old, we can all agree that 50 is not, at least I hope not, but as our clients are aging, their needs are changing, and it's a wonderful thing that they're aging, but then, we're moving from crisis management to, again, living long-term, healthy lives and thriving, and what do you need today? And many of we have some family cases, so it may not necessarily be our client who's medically eligible who needs extra assistance. It may be a family member, another member of the household who may need additional treatment and additional help. So we help the whole family, and we're very proud of that. But as I, mentioned earlier, one of the things I like to join with Reginald and other activists is making sure that, we keep our eyes on the ball, keep our eyes on the prize, and making sure that the funding and the awareness is still there, so that many of the advances that our people made back in the 90s, back in the early 2000s, and continue to make, that future people who are diagnosed with HIV can have the same advantages and the same access to services that our current client have. We could lose ground. We could lose a lot of the ground that we've made. We can lose it. We can't take it for granted. So, thank you.
So Laura Morrison, as she told you, has been an activist for more than 40 years. And you worked for Tom Dwayne, who was the first city council member to come out about having HIV during his campaign. He told this was a big deal in those days. So now, what are the priorities from an activist perspective now? And I also want to hear about, because you work at Treatment Action Group, to get, are older people being included in the clinical trials for all these new treatments?
I'm not in the research directly, so I can't tell you about that aspect. I will tell you, we know that we can end this epidemic. I think this is the priority right now. And TAG, along with Housing Works, really spearheaded the Ending the Epidemic effort here in New York State, because we have drugs, we have PrEP, we have PEP. So what those are,
Want to explain what those are?
Pre-exposure and post-exposure prophylaxis. We have medications that, and we're getting longer acting medications all the time that actually work. But of course, you have to get this into people's bodies, and people are struggling with issues like housing, like food and transportation and stigma, which is still a huge problem. One of the things we wanted to do with Tom Dwayne, one of the things he spearheaded was this idea of the universal offer of HIV testing. Some people wanted to have mandatory testing without consent. We thought it was really important to have the conversation, which also helps to destigmatize testing. But we know that if people have the drugs, they have a roof over their head and life stability and other supports, that we can end this epidemic. And we're actually making progress in New York State, and that is something that TAG is working really hard to try to see through to getting us below a level where we actually have an epidemic. And this is an issue this is an effort that we've been doing in collaboration with groups across the country to try, particularly in the Deep South, where it's a much bigger political challenge, but we have wonderful allies who we work with down there. And we've been very involved in Africa with 65% of the global HIV burden in sub-Saharan Africa. And then we just pulled out UNAIDS a couple of months ago. So these are real challenges. And so TAG is trying to work on real creative solutions to help communities and empower communities to end these epidemics themselves. And so I should say TAG started just focusing on HIV, but increasingly over the years, we were losing people to tuberculosis and HCV, hepatitis C. So we now work on all three pandemics, and they're very much connected.
Hello. As far as clinical trials go, I have enrolled in several clinical trials because Black people are woefully underrepresented in these. An example was the COVID vaccine. Originally, Moderna did not want to include people who were HIV positive. The HIV positive community said, "Oh, no, you will include us." I was number 5 of 30,000 people to get the COVID vaccine. I got vaccinated on September 1st, 2020, but that's just one of them. That's one of the things. Also, 10 years ago, I was part of a trial to get that long-acting injection. The point is that I put myself on the line because of all the people who put themselves on the line for me. I owe it to them. Also, stigma is more deadly than HIV still. This blows my mind because we now know everyone has a status. Hello, everyone has a status. Know your status and act accordingly. HIV is no longer a death sentence, but stigma will kill you quicker than HIV will. And that, I don't know, the only way I know how to do that is to say, hey, look at me. I'm a person who's living with AIDS, and whatever you think that might have looked like, I've just changed the mind. So I have to make sure, especially among Black people, to let them see what this looks like. It's not a monster. I'm a person. I'm 73 years old. I'm still here, and I will continue doing this as long as I'm still here.
So when people were asked like how many people you know that have HIV or who is HIV in this room, while we're talking about our story, in some sense, I think I want to connect that putting ourselves on a line for HIV and AIDS to, in honor of the many people that died and also for our own survival. But I wanted to take like a focus is important because a lot of people think is our issue, right? But as Laura had talked about, there's co-illnesses like TB and all the stuff that we're continuing to work. But that investment with our lives, for those who passed away and those who are still here that are positive, especially the long-term survivor, what I wanted to share with the room is that work that we do, that investment that we do, is actually not just for us. The science that we have been able to push in the new treatment, when we look at COVID, which everybody can have that, experience together. And a lot of people have been talking about why it's so quickly, all that. It's because it's rooted in the work and the data that we put in for 30 years. That vaccine didn't get created at that moment without all this. The structure that we change in the US government, even to have a vaccine centers, were implemented by HIV activists. And when you take that Paxlovid, there's two pills. One is an HIV drug from 1997. So our investment doesn't look this myopic into ourselves. It's change healthcare, including how insurance wouldn't cover us if you have pre-existing condition. Privacy Acts, all that has HIV DNA structural changes for just about everything. And I think at one point you should ask about Ryan White as well.
And by the way, no matter what disease you or your loved ones are experiencing, these days, because of these folks and what they did around AIDS, there is probably an activist group about it, whether it's breast cancer or whatever it is, autism, anything, all these things. This started with the AIDS movement, and now everybody who says, well, I'm not going to let the experts tell me, I'm going to stand up for myself and we're going to do something about it. Now, having said that, we are getting killed, literally, by the Trump administration and their HHS, RFK Jr. quacks. I mean, they are decimating the Centers for Disease Control. They're putting unqualified people in there. And, our commitment to aiding people with HIV abroad is disappearing, and that's going to lead to the deaths of millions. But in the city, what is the most alarming thing on the cutback and policy front as it affects New York, and what are we doing about it? Any?
Breastfeeding implementation for the next or future generation. Breastfeeding stops and combats AIDS, HIV, and all diseases because it's a regulatory system that allows the body to regulate itself.
Okay.
Breastfeeding.
Thank you. We're going to take your questions and comments, and before long here, we're going to get cut off, and then that's going to happen. But I'm asking this question. We're in a crisis. So what are we doing to make up for what is being cut in Medicare, Medicaid, Affordable Care Act, basic things?
Hi.
And speak into the mic.
Fortunately, thankfully, the HASA program is still able to provide our clients with access to necessary services, cash assistance, access to rental assistance, supportive housing, very important Medicaid. But we are concerned, as was mentioned earlier, about the lack of funding towards prevention and treatment for HIV overseas and in other places in underdeveloped parts of the world, because we know that whatever starts there eventually comes here. We're a very mobile society, and we are starting to see our caseload go up. After years of being, fairly stagnant, our caseload is starting to go up. And I don't, happening around the same time doesn't necessarily prove causation, but I don't think it's any small wonder. And so we are concerned about the lack of funds going toward treatment and prevention overseas, as we talked about earlier. And we are afraid that eventually that could affect the numbers of people living with HIV in New York and around the country. So one of the things that, certainly I would recommend, personally is, continue our advocacy and our partnerships with organizations like Vocal and like SAGE and like TAG to keep the pressure on so that, we can hopefully at some point get that funding restored. Because I think it's critical that, we don't other any group of people think what happens over there cannot affect us, because it absolutely certainly can.
There we go. SAGE has seen a definite increase in the number of our participants who are accessing our food pantry programs at all 4 of our centers across New York City. We also have programs down in South Florida where we're seeing an increase in terms of services, both food insecurity services, but also access to benefits. We hear from a lot of our participants, including immigrants, including legal immigrants, that they are afraid of applying for benefits for fear of reprisal. And so our care managers, our advocacy group are really springing into action to try to make sure people are connected with benefits. SAGE was the first, at the beginning of this year, SAGE was the first LGBTQ plus nonprofit to sue the Trump administration and to win, to stop the federal funding freeze. And so SAGE is looking towards all avenues to address these issues.
So we know that, I think that one of the clear points is the defunding, right? The dismantling of systems. So it's the financial, and dismantling is also dismantling education. So the noise of like what is, misinformation, all that. So I really think like we need to step up our political accountability. We have to make sure we keep on voting and canvassing people that have expertise. And our last election was, I think, a great manifestation of that hope that can happen. And I think that if we all take our time to look at the transition team that's coming in, I think it's super inspirational. Because we actually in New York City, I think, not New York City, New York State, part of the component that we really have to be political about is that we are a tax donor state, which pays insurance for other people, other states. That vote for a Republican or this policy, we need to step it up. We need to have more people in Congress that are, healthcare advocates for us. We have to completely be focused, because this is the one thing we're talking about is like, the one thing Republicans are good, they're very focused, and we're not. And we are losing. I mean, I don't think that we should think about, is it gonna get cut? And right now we still have funding. We're not gonna have the funding. The midterm elections and in between every fucking election, everybody has to be on point. Taxation is super important in how we learn to navigate as citizens and understand financial taxation and how we can reclaim some of those, because we're gonna need that to keep our clinics are closing already. We never recover from 2017 Trump's presidency. People forget that he started funding a lot of HIV services that never came back because then we had COVID. So I think that we really, the one thing I would say, be as educated as you can about taxation and how you vote, and force the elected official to focus on that. When there's no money, none of the stuff is possible. It's clearly, that's it.
Okay. You know, a lot of the activists I see out there are from our generation. I mean, young people are doing stuff, but when you know, like Rise and Resist is out there every day, you know, protesting, whether it's about what ICE is doing, about what Trump is doing, about all these cuts and things like that. So how are we going to engage the younger generation in the fights that we've taken up?
I think they're already stepping up. I mean, I go and I see it's very intergenerational. It's everybody. It's everybody. But the people are stepping up because they realize that if we don't say something, no, we realize the importance that our presence and our voices have. People say, well, marching doesn't do anything. I would say marching does do something. If nothing else, we learn from the civil rights. We learned that marching does change things. We marched and we got a democratic socialist. We marched and things have changed. So whatever you do, whatever you can do that. Because the thing is that don't do nothing. The only way that you lose is by not doing anything. If you do something, something will happen. So as far as I'm concerned, I'm glad that I'm laying the ground. I'm standing on the shoulders of those who came before me, so that those people that follow me can stand on my shoulders. It's all about that. It's all about that. So I have faith in the young people because I think they understand it a lot easier than some of you all, perhaps. To be frankly, I don't know, but they're aware of that. So I'm excited, and like I said, as long as I have breath, I'll be out there.
Yeah, I agree. I don't feel like it's just us, the older generation. I feel like we've just elected one of the youngest mayor. That is super. That was a master class. A master class of you know, coming to the plate, and the team that they have. That signals me that they're totally engaged. My son, who never gets involved in politics, was canvassing this time.
No, I wasn't trying to say young people are involved, because they obviously they are. I was talking about in terms of these HIV/AIDS issues, which, you know, people in many ways seem to be forgetting.
And I would agree with my panelists that I see young people getting involved, people in their 20s and 30s, both in HIV issues, but also in aging issues. I think of one of SAGE's first programs was our Friendly Visitor Program, which matches volunteers with older adults for ongoing social support in the form of weekly visits. And truthfully, we have sometimes more volunteers coming through our doors than we know what to do with. And the primary reason that these people in their 20s and 30s, also 40s, 50s, 60s, 70s, who volunteer with us, the primary reason is because they believe, they see that these LGBTQ+ elders that came before them paved the way for their own freedoms, and that they want to give back to them. And so I think activism comes in many forms, and I think one form is a 23-year-old volunteering to visit an LGBTQ+ older adult every week. So I'm seeing that in a lot of our programming.
Okay. So obviously I don't get out enough.
And I was also going to say, our young people, I think more than I certainly did 45 years ago, recognize the intersectionality of HIV/AIDS with all these other forms of oppression, and the fact that we can't separate this. So when I go out and I demonstrate, which I don't do every day like I used to 45 years ago, but when I do see this, intergenerational group, and I also see that we are talking about social justice and human rights for all, and HIV/AIDS is part of that, and ending the epidemic is just one of our aims.
And let me just ask the audience, how many of you have engaged in your life in some form of what you would consider activist activity? Well, that's great. That's great. We have a lot of activists in this room. And let me just ask, I know we're going to be getting to your questions. Just very briefly, what sparked your activism? your life? You know, what was the thing that made you from a, you know, just a regular old citizen to a activist? What happened?
You know, from the beginning, as long as I can remember, I knew I was different. I knew I was queer. So I've always looked at things from another way. So I've always stood up for things that I always stood up for anybody who got demonstrated, how are they, were mistreated because I was mistreated. So I'm always ready to stand up for someone because as a kid, I knew that I was different and I was picked on for being different. So I made it my business. If somebody's getting picked on, I'm going to help that person.
When I was 20 years old, I went to get HIV tested because I was sure that I must have contracted HIV, even though looking back, there was a great deal of ignorance on my part, knowing how HIV is transmitted at 20 years old. And I tested at the Mazzoni Clinic in Philadelphia and was so impressed by that experience that I decided to volunteer there. And I found in that clinic, I don't know if you all have had this experience where you come into a community and you realize, oh, yeah, these are my people. Oh, okay. And it was this incredible experience that for the first time, very much like you, I had found my community, my tribe, and that's what propelled me into a lifetime of service and activism in these communities.
I think, okay, I think, certainly, I think my background, my parents' background, my family, you know, our roots in the deep South and our roots with dealing with the inequities and the injustices in the deep South and how that translated and was always discussed in my home and with me. We were not, I was just thinking about this morning, like, you know, we were, you know, not one of the fortunate people who were, you know, going to HBCUs back in the early, you know, 1920s, my family was sharecropping in the Deep South until the mid to late 50s, you know, so that's where I come from. And my family comes from Lowndes County, Alabama, which has a deep history of civil rights and civil rights struggles, and particularly around voting rights. And my family was very involved in that, and that informed me as I came to, my family moved to New York, and that's where I was born, and that's what's really got me involved in all forms of injustice and civil rights, because of how it affected my family personally, and how my parents, my mother, who's still alive, can tell you how they had to sneak out of, you know, Alabama in the dead of night because she was one of her landowner's best workers, and he didn't want her to go. So she had to sneak with her children in the dead of night. So stories like that, you know, informed me, really instructed me and made me who I am, and informs who I care about and what I care about and how I fight for injustice wherever I see it because of my own personal struggle, my family struggle, and how I got to where I am. And I'm standing, as others have said, I'm standing on the shoulders of a lot of people who suffered and struggled to get me where I am, and I don't take it for granted.
I guess for me, it partly came from being a lesbian growing up in the 80s, coming of age in the 80s, when, you know, I definitely felt that I was not accepted in society. But then watching the gay men in my community, like young gay men, again, people my age, dying, wasting, looking like the bones were sticking out of their heads. They were using canes. They were covered in lesions. You had to act. It was like a nightmare, and you had to act.
Well, I didn't want to die. And I was so angry because I was like watching so many people die. I had just moved to New York, so I didn't know anybody. So suddenly I'm in a room with people far advanced in illness where their families or sometimes their partners like left them. So I was so angry. And I saw the courage. You know, people would come to ACT UP from St. Vincent, because it was around the corner to the center, in their gurneys, fighting every single breath. And to the point that they have learned that through their death, through their documentation of the illness, that they put it in the archives so that treatments could be advanced. That was like their last days, last moment. So I was angry, and I did not want to die because I wanted to honor their courage. And also there was a rush. Of service that kept me alive. Like, I mean, I was in a room that there were people that knew far more than I did and was willing to share, and that had put hours and hours of their time beyond their education or comfort level to rise up, to be able to be in rooms with top researchers globally. And so that was like a rush that kept me alive, right? And also to see the change. I mean, the amount of change we've done is pretty incredible. And you know, unlike most people in this panel, I don't have a history. I'm a straight person, but yet within HIV and AIDS, like there was no boundaries as important as showing up and staying with the work. And it's a lot of sacrifice, you know, it's a lot of hours. A lot of us do this as volunteers, and I spend as equal or more time than my work. But I do it for everybody that was courageous.
Well, I'm a white boy from the suburbs, and you know, I went to the University of Virginia, and I was closeted. And then I was with a guy, you know, was still, you know, and then he dumped me, and so I went to a gay student union meeting at the University of Virginia, and I'd never gone to one. So I go into the meeting, and these people cannot elect a president because that meant putting your name on something. So since I was in a kind of a low mood, I said, I'll do it. And I became the president of the damn group. And then, and it's just what Ivy said. The rush you get for standing up for yourself, for not being afraid anymore, you know, for, you know, that kind of thing, it's what drives me. So that's how I got started, and life has been different ever since. All right, now we've got to take questions. Oh, they're written down? All right. So the question is, for those of you who are HIV positive, how did you feel when they told you that you had HIV?
Well, I actually didn't know what it really meant.
Oh.
I couldn't even get an HIV test. It took me a while because of the wheat pasting from ACT UP, and the headline was, "Women don't get AIDS, they just die from it." So I went, and underneath it said why you should test is because, you know, you might not be, you know, a drug user, but maybe you had one or two partners, somebody was using it, you know, just like sexual health. And I had been sick for a while, but I didn't know what it meant. And I was taught by the community.
Okay.
The community that actually got me to testing. So I couldn't find a doctor. I went to ACT UP. I still volunteer for ACT UP. We meet every Monday since 1983. And that's part of, like, I work with just young people. 87. So I show up, like tonight, even tonight I have a meeting that I'm facilitating with young people. So we're,
Wow.
it's my self-harm Monday, I call it.
Thanks for keeping it going.
As I mentioned before, my universe stopped. However, I wasn't surprised because I've been sexually active. I mean, I enjoy sex. I mean, I like it, it's fun. So I said, okay, so it did not surprise me, but as I said, though, actually to hear that, not knowing anything about it other than what I heard, and all these horror stories, and being in Europe and away from everything that's going on, I didn't know what to think. I said, oh my God, am I gonna die, or am I not gonna have sex anymore? I mean, I did not know what to do, but like I said, my spirituality was able to get me to look at it the other way. And when we leave here, Ivy and I are going to go up to the reading of the names. So when we leave here, we're still doing this. We're reading of the names. So how would I say that? That's how I did. But my mother was a nurse, so I grew up having medicine as part of my background. So I said, okay, I need to figure out how to do this. So that's it. So I think I understand. Yeah.
Now, I'm not completely sure I understand this question, so whoever asked it, I will ask for clarification. It says, what percentage of diagnoses will occur for a new generation in the next 5 years? What is that? Who asked the question? Tell me what you're asking here. And what do you anticipate for the next 5 years, given all the advancements and all the problems?
Well, we have like very effective treatment right now, including like long-acting medication, meaning that you can take medication once a month instead of every day. What do we expect? We're going to expect a rise of HIV and AIDS because they're cutting the treatment, the testing, and the prevention. It's very clear. It's not like it's going to happen. It's happening. So we can expect high infections and high death.
I mean, Commissioner Dudley, you said that your caseload is increasing.
That is true. For many years, we were pretty stagnant. Our caseload was pretty stagnant, but we are starting to see an increase. When you look at the DOHMH surveillance reports that come out annually, for a long time we were starting to get fewer and fewer new diagnoses from HIV, and we're starting to see in the city of New York a rise in new diagnoses for HIV. Initially, I think I'm not a clinician, but initially I think the experts at DOHMH and other places have thought that perhaps it was a result of people who had not seen a physician during the COVID crisis, and were starting to go back to the doctor and getting diagnosed. They were hoping that was the reason for the rise in increase in diagnoses. But now we're not sure anymore. I think much to what Ivy is saying, I think because of the reduction in funding for treatment and prevention, I think we are sadly going to see a rise in diagnosis. And what's worrisome is that certainly, back in the 80s and the 90s, it was more of a crisis, and I'm worried that people who get newly diagnosed don't see it as a 5-alarm fire that maybe we saw back in the 90s. Oh, it's a chronic illness, and it is, but it needs constant treatment, and you need care, and that takes money, and that takes resources, and that takes CBOs, community-based organizations, to provide assistance and care and guidance on how to live a lengthy a life living with HIV.
And a quick question before you finish. People want to know, what is the salary level you need to have to be, or I guess under, to be a part of the HASA program?
Anyone can be a member of the HASA program. You only need to have an HIV diagnosis, and you can receive intensive case management. So that's anybody.
So
now,
it's not means tested.
It is not at all. You could have a 6-figure, 7-figure salary and receive case management from HASA if you wish to. However, if you do need cash assistance or SNAP or Medicaid, the same requirements for eligibility that anyone else would have, you would have to meet those requirements. The good thing, for the HASA program is that we do have an enhanced level of shelter allowance for persons who are living with HIV. However, you do need to meet the financial requirements in order to qualify for those benefits.
As I mentioned before, I'm a former HASA client only because now I have enough financial money that I don't have to be a client. However, I'm still a part of HASA. I can go back to HASA at any time, but I don't get any financial assistance from them anymore.
Can I just circle back in terms of the number question before, really quickly? A percentage that has been consistently high is the number of older adults who are co-diagnosed with HIV and AIDS. And what that means is that their HIV has progressed to a point where it is now AIDS. So that is a consistently, both in New York State and federally, a high percentage that needs to be addressed just by conversations that medical providers need to be having with their with their clients, with their patients, and talk about an intersection of stigma and ageism, right? Oh, surely older adults aren't at risk for HIV, which of course isn't the case. And so these conversations need to be taking place both in the provider office, but also at other agencies as well about behavior.
And the question here is, what are the advantages of choosing your meds? Now, I mean, how do people, once they're diagnosed, choose their meds? Is it different for everybody? How does that work?
Whenever I have a conversation with my doctor, it's never a one-way. It's never a one-way. We discuss it. What are the side effects of this? Do I have to eat it with food? So it's a matter of discussing with it. But the point is, all of my doctors have been HIV doctors, so they've been in the forefront of knowing what's going on. And I've been in clinical trials for even HIV products. Some of the HIV medicines I'm taking now, I was actually in a clinical trial for.
And we should say that we do have drugs that can keep HIV under control to the point where people with HIV, when they take these drugs, they can't infect anybody else.
I haven't been able to do that since 2003.
They can't infect anybody else.
Nope.
And people, I'm HIV negative. I'm kind of retired from playing the fool. But if I wanted to take this drug called PrEP, I wouldn't get HIV. They have a drug for it now for sexually active people who take risks. You won't be taking any risk if you take PrEP. So they don't have to worry. But there are other diseases that we have to worry about, and everybody does. And so that happens for people with HIV.
And PrEP, when used correctly, works 99%.
Right.
I mean, and that's what they're cutting.
But the point is, we got to get people on the drugs. How are we doing? Are we good? We're good. We're going to wrap it up. Well, thank you to this panel, and thank you all for coming.
Here, the thing that we always talk about is, and the panel ended on this, if you're mingling, if you have your flirt nights, if you're hanging out with new people, this is an issue that you must be aware of and make sure that it's about positive sexual health, which includes HIV prevention and cure. We live in a time of erasure, unfortunately, right? Andy started off by saying really briefly that anyone from the federal government isn't necessarily able to talk about World AIDS Day today. We've been here before, and we know that having sessions like this, acting up, speaking out, because silence equals
death.
Silence equals death. It is important for us to always make sure that we honor our histories and that we're doing the work today to keep everybody engaged. So I want to say thank you once more. On some of the numbers, 14% for some of the surveillance data, 40% over 50 are new infections. That is not a little bit. This is our issue. Team who put it together, Agnes, Sabrina, Charlie and crew, appreciate you. Have a great afternoon.